So in this video we'll discuss about ischemic heart disease or coronary artery disease continuation. Angina. What is angina? Angina is pectoralis. What is it? Pectoralis. It is a chest pain. Patient have substernal discomfort. It is not actual pain. It is only discomfort. Patient will say, I am having pain. Little bit left side. Substernal, just below the sternum. Little bit light side, left side. Having heaviness. Quizzing feeling. So what is angina? It is not continuous. The patient have pain between two episodes. After that, absolutely normal, like asthma. So when the patient have the episode, the attack of that angina, at that time the patient have substantial discomfort. And between two episode patient is absolutely normal. So between two attack patient is normal. This one anytime it will come. So anytime it will come and goes. So in this condition in pathology we are calling paroxysmal. What is paroxysmal? The disease is coming in the attack. It is recurrent. It is again and again the attack comes, and it is substernal discomfort. It is not pain. It is just discomfort. It is transient MI, myocardial infarction. The ischemic is transient. The pain or discomfort, it comes, it goes, it comes and goes. So what is the main problem? The main problem is demand versus supply. There is an imbalance between them. So what are the three types of angina? Stable or classical. Second one is unstable or crescendo angina. Third one is princemental or variant angina. So what are the three types? Stable, it have another name classical. Unstable, it have another name crescendo. Then princemental or otherwise called as variant. Why it is important to know three type of angina? Because prognosis and treatment also different. So first we will discuss that classical or stable angina. Among three, this is the most common. What is the reason? This one is coronary artery. Supply blood to the left ventricles wall. So it supply blood to left ventricle wall. First one, producing atherosclerosis. In this coronary, because of this atherosclerosis, blood reduction will be taken. So here atherosclerosis means blood reduction. Blood supply will reduced. Blood reduction will be there. The blood supply will be reduced in the coronary, and because of which this angina will occur. It is known as stable angina. Because of atherosclerosis, angina occur. It is known as stable angina. Stable or classical angina is due to atherosclerosis, but atherosclerosis never completely obstruct. If someone is having atherosclerosis and one of the coronary artery and the atherosclerotic plaque is partially obstructing the lumen, partially obstructing the lumen of the coronary, so heart wall is still getting the blood. That blood is sufficient for basal metabolism. Less blood is sufficient for basal metabolism. You are giving less blood by a coronary heart, it will also give less blood. But that less blood is sufficient to all basal metabolism. All basal metabolism, it is sufficient. If we do nothing, just sitting down, that blood is sufficient for our body. But if we start running, jogging, doing any physical activity, demand of the blood is increased. You know that at that time organ are asking for more blood to the aorta, but we are giving less blood, so heart also given less blood only. So the patient during running, jogging, patient having chest pain at that time. So patient having chest pain, whenever sit down the pain disappeared. So during body activity need high blood, but that time our heart not supply, so that patient having pain, whenever they sit down the pain disappeared. It is classical angina. Physical activity just discomfort, at the rest disappear. So during physical activity they have pain, then when they will take rest, that time the pain disappear. Normal body metabolism, it is enough. During physical activity only demand of high blood, that time only patient having paining. So this is all about stable or classical angina. So second type, unstable angina. The obstructions of coronary is still, but it is not that atherosclerosis. It is some non-atherosclerotic causes. It can be thrombosis, or it can be classification, that calcification, or it can be plaque, or it can something else, but it is known as atherosclerotic cause. It is not atherosclerotic cause. This one because of thrombosis and calcification. It is usually, sometimes it can causes complete obstruction of that coronary. The complete obstruction can be there. So patient can have pain every time. At the exertion also, at the rest also. So when they have physical activity, that time also, rest time also, they have pain. So this differentiate the unstable angina. So it is different from stable. Stable, when we have take rest, that time the pain is gone, but here pain continue. Third, princemetal or variant angina. The causes of obstruction is not atherosclerosis. The causes of obstruction is not thrombosis. The causes of this atherosclerosis is here because of vasospasm. First one is because of atherosclerosis. Second one because of thrombosis and calcification. Third one because of vasospasm. Third type of angina causes the obstruction of vasospasm. Anytime it can come, anytime it can go. So these are the three type of angina. Last one is treatment. Stable angina, there is atherosclerosis. You will should standing. There is no drugs which can dissolve the already formed atherosclerosis. For that, you can have to dislodge it or do for standing. What is standing? Surgery. So atherosclerosis, first one is stable angina treatment. Standing for is surgery. Second one is because of thrombosis, so we will give antithrombotic drug, statin. Third one is because of vascular spasm, so vasodilator we can use. So this is all about three type of angina. Thanks for watching.